1. What is the primary goal of therapeutic communication in mental health nursing? A. To provide advice to the patient. B. To establish a trusting relationship with the patient. C. To reinforce the patient's delusions. D. To control the patient's behavior. Answer: B. To establish a trusting relationship with the patient. Rationale: the primary goal of therapeutic communication is to build a trusting relationship that allows the patient to express emotions safely. Option A is incorrect because providing advice is not always therapeutic. Option C is incorrect as reinforcing delusions is unethical. Option D is incorrect as controlling behavior is not the goal. 2. A patient with schizophrenia states, "The government is controlling my thoughts." What is the best nursing response? A. That must be very frightening for you. B. You should ignore these thoughts. C. The government is not interested in you. D. Why do you think that? Answer: A. That must be very frightening for you. Rationale: acknowledging the patient's feelings without reinforcing the delusion is the best response. Option B dismisses the patient's experience. Option C contradicts the delusion, which may cause distress. Option D may encourage further delusional thinking. 3. Which medication is commonly used to treat bipolar disorder? A. Fluoxetine. B. Lithium. C. Haloperidol. D. Buspirone. Answer: B. Lithium. Rationale: lithium is a mood stabilizer used to treat bipolar disorder. Fluoxetine is an SSRI used for depression. Haloperidol is an antipsychotic. Buspirone is used for anxiety. 4. A patient experiencing a panic attack should be: A. Left alone until the episode passes. B. Encouraged to use slow, deep breathing techniques. C. Asked to discuss their fears immediately. D. Given a stimulant medication. Answer: B. Encouraged to use slow, deep breathing techniques. Rationale: slow, deep breathing helps calm the nervous system. Option A is incorrect because patients need support. Option C may increase anxiety. Option D is incorrect because stimulants can worsen anxiety. 5. What is the most important safety intervention for a suicidal patient? A. Encouraging group therapy. B. Placing the patient in seclusion. C. Removing all potentially harmful objects from the environment. D. Asking the patient to promise not to self-harm. Answer: C. Removing all potentially harmful objects from the environment. Rationale: removing harmful objects reduces the risk of self-harm. Option A is helpful, but not the primary safety measure. Option B may increase isolation. Option D is not a reliable prevention method. 6. A patient with depression states, "I feel hopeless and want to die." What is the nurse's priority action? A. Ignore the statement to avoid reinforcing suicidal thoughts. B. Ask the patient if they have a plan to harm themselves. C. Tell the patient to think positively. D. Change the subject to something cheerful. Answer: B. Ask the patient if they have a plan to harm themselves. Rationale: assessing suicide risk is a priority. Option A ignores the patient's distress. Option C is dismissive. Option D avoids addressing the issue. 7. What is the priority nursing diagnosis for a patient experiencing alcohol withdrawal? A. Risk for self-harm. B. Risk for injury. C. Ineffective coping. D. Social isolation. Answer: B. Risk for injury. Rationale: alcohol withdrawal can cause seizures, making risk for injury a priority. Other options are relevant but not the most urgent. 8. Which side effect is most concerning with clozapine use? A. Sedation. B. Weight gain. C. Agranulocytosis. D. Dry mouth. Answer: C. Agranulocytosis. Rationale: agranulocytosis, a severe decrease in white blood cells, is a life-threatening side effect of clozapine. The other side effects are common but less dangerous. 9. A patient in the manic phase of bipolar disorder is pacing and talking loudly. What is the best intervention? A. Confront the patient about their behavior. B. Encourage the patient to sit quietly. C. Offer a low-stimulation environment. D. Force the patient to take medication. Answer: C. Offer a low-stimulation environment. Rationale: a low-stimulation environment helps reduce agitation. Confrontation: A. May increase aggression. Option B is unrealistic. Option D violates patient rights. 10. Which symptom is characteristic of PTSD? A. Flashbacks. B. Euphoria. C. Increased energy. D. Hallucinations. Answer: A. Flashbacks. Rationale: PTSD is characterized by intrusive memories and flashbacks. The other symptoms are not typically associated with PTSD. 11. What is a key sign of lithium toxicity? A. Diarrhea and tremors. B. Increased appetite. C. Hyperactivity. D. Constipation. Answer: A. Diarrhea and tremors. Rationale: early signs of lithium toxicity include diarrhea, tremors, nausea, and confusion. 12. A patient with OCD is repeatedly washing their hands. The best nursing intervention is: A. Forcing the patient to stop. B. Allowing the behavior without limits. C. Setting time limits for hand washing. D. Ignoring the behavior. Answer: C. Setting time limits for hand washing. Rationale: setting limits helps manage compulsions while reducing anxiety. 13. A nurse is teaching a patient about fluoxetine. What is an important side effect to monitor? A. Increased suicidal thoughts. B. Hypotension. C. Dry mouth. D. Muscle rigidity. Answer: A. Increased suicidal thoughts. Rationale: SSRIs can increase suicide risk, especially in young adults. 14. Which intervention is most appropriate for a patient experiencing auditory hallucinations? A. Telling them the voices are not real. B. Encouraging reality-based activities. C. Asking what the voices are saying. D. Providing reassurance without addressing the hallucination. Answer: B. Encouraging reality-based activities. Rationale: reality-based activities help distract the patient and reduce hallucinations. 15. Which ethical principle is violated when a nurse shares patient information without consent? A. Autonomy. B. Beneficence. C. Confidentiality. D. Non-maleficence. Answer: C. Confidentiality. Rationale: confidentiality protects patient privacy and should not be breached without consent. 16. A nurse notices a patient with depression is not eating. The best approach is: A. You need to eat or you'll get sicker. B. Can you tell me why you aren't eating? C. I'll leave your food here if you change your mind. D. If you don't eat, I'll have to report it. Answer: B. Can you tell me why you aren't eating? Rationale: open-ended questions encourage discussion and problem-solving. 17. What is the priority intervention for a patient having a panic attack? A. Encouraging deep breathing. B. Offering food. C. Asking about childhood trauma. D. Telling the patient to calm down. Answer: A. Encouraging deep breathing. Rationale: deep breathing helps regulate anxiety and panic. 18. A nurse suspects a patient has been abused. What is the priority action? A. Ask the patient directly about abuse. B. Report suspicions to authorities. C. Wait for more evidence. D. Ignore it unless the patient mentions it. Answer: A. Ask the patient directly about abuse. Rationale: direct questioning helps assess safety. 19. What is a negative symptom of schizophrenia? A. Hallucinations. B. Delusions. C. Flat affect. D. Paranoia. Answer: C. Flat affect. Rationale: negative symptoms include a lack of emotional expression. 20. A nurse caring for a suicidal patient should prioritize: A. Providing a safe environment. B. Encouraging independence. C. Discussing long-term goals. D. Offering group therapy. Answer: A. Providing a safe environment. Rationale: safety is the highest priority in suicide prevention. 21. A patient with major depressive disorder shows no improvement after weeks of medication. What is the next step? A. Increase the dosage immediately. B. Stop the medication. C. Consider alternative treatments like ECT. D. Add an anxiolytic. Answer: C. Consider alternative treatments like ECT. Rationale: electroconvulsive therapy, ECT, is considered when medication fails. Increasing dosage, A, or stopping medication, B, without medical supervision is not appropriate. 22. A patient with schizophrenia is experiencing command hallucinations. What is the priority nursing action? A. Ask the patient what the voices are saying. B. Tell the patient the voices aren't real. C. Ignore the hallucinations. D. Ask the patient to focus on reality-based activities. Answer: A. Ask the patient what the voices are saying. Rationale: command hallucinations can be dangerous if they instruct self-harm or violence, so assessment is crucial. 23. Which of the following is an example of a cognitive distortion in a patient with anxiety? A. I always fail at everything. B. I will try to do my best. C. I can improve if I practice. D. I know I have strengths and weaknesses. Answer: A. I always fail at everything. Rationale: cognitive distortions involve negative and exaggerated thoughts. Always statements are examples of all-or-nothing thinking. 24. What is the most important nursing intervention for a patient with anorexia nervosa? A. Allow the patient to skip meals if they refuse. B. Monitor vital signs and electrolyte levels. C. Focus on appearance to encourage eating. D. Provide laxatives if constipated. Answer: B. Monitor vital signs and electrolyte levels. Rationale: anorexia nervosa can lead to life-threatening electrolyte imbalances, so monitoring is critical. 25. A patient with PTSD is having a flashback. What is the best response? A. You're safe. This is not happening now. B. You need to stop thinking about the past. C. Tell me more about your trauma. D. You should try to move on. Answer: A. You're safe. This is not happening now. Rationale: grounding techniques help reorient the patient to the present. 26. What is a common defense mechanism in patients with addiction? A. Intellectualization. B. Denial. C. Projection. D. Sublimation. Answer: B. Denial. Rationale: denial is a common defense mechanism where individuals refuse to acknowledge substance abuse problems. 27. A nurse is assessing a patient with Alzheimer's disease. What is an expected symptom? A. Rapid mood swings. B. Increased energy levels. C. Progressive memory loss. D. Enhanced problem-solving skills. Answer: C. Progressive memory loss. Rationale: Alzheimer's disease is characterized by gradual memory loss and cognitive decline. 28. Which intervention is best for a patient experiencing severe anxiety? A. Encouraging deep breathing exercises. B. Providing detailed explanations of procedures. C. Asking the patient to make important decisions. D. Leaving the patient alone. Answer: A. Encouraging deep breathing exercises. Rationale: deep breathing helps reduce anxiety. Complex explanations or decision-making can worsen anxiety. 29. A patient is on an MAOI. What food should be avoided? A. Chicken. B. Bananas. C. Milk. D. Eggs. Answer: B. Bananas. Rationale: MAOIs can cause hypertensive crisis when combined with tyramine-rich foods like bananas, aged cheese, and wine. 30. Which symptom indicates serotonin syndrome? A. Hypotension. B. Muscle rigidity and hyperreflexia. C. Weight loss. D. Depression. Answer: B. Muscle rigidity and hyperreflexia. Rationale: serotonin syndrome is a life-threatening condition characterized by hyperreflexia, tremors, fever, and autonomic instability. 31. What is the priority nursing action for a patient with a history of violent behavior who becomes agitated? A. Use therapeutic communication techniques. B. Physically restrain the patient. C. Administer a sedative immediately. D. Ignore the patient's behavior. Answer. A. Use therapeutic communication techniques. Rationale. Early intervention with communication can de-escalate agitation before restraint or sedation is needed. 32. A patient with schizophrenia has flat affect and social withdrawal. What type of symptoms are these? A. Positive. B. Negative. C. Cognitive. D. Mood-related. Answer. B. Negative. Rationale. Negative symptoms include diminished emotional expression, withdrawal, and lack of motivation. 33. A patient with bipolar disorder is experiencing mania. What is the best nursing intervention? A. Encourage large social gatherings. B. Provide a low-stimulation environment. C. Allow the patient to direct their care. D. Engage the patient in lengthy conversations. Answer. B. Provide a low-stimulation environment. Rationale. Reducing stimuli helps prevent escalation of manic symptoms. 34. Which medication is commonly used for alcohol withdrawal? A. Haloperidol. B. Disulfiram. C. Lorazepam. D. Fluoxetine. Answer. C. Lorazepam. Rationale. Benzodiazepines like lorazepam help prevent seizures and manage withdrawal symptoms. 35. Which patient is at highest risk for suicide? A. A 35-year-old woman with mild depression. B. A 21-year-old male with previous suicide attempts. C. A 50-year-old man with chronic anxiety. D. A 40-year-old woman with PTSD. Answer. B. A 21-year-old male with previous suicide attempts. Rationale. Previous suicide attempts and being male increase suicide risk. 36. What is a priority nursing action for a patient with antisocial personality disorder? A. Set clear limits on manipulative behavior. B. Encourage dependency on staff. C. Provide extensive emotional support. D. Allow the patient to break minor rules. Answer. A. Set clear limits on manipulative behavior. Rationale. Patients with antisocial personality disorder often manipulate. Clear boundaries are essential. 37. Which neurotransmitter is primarily involved in depression? A. Dopamine. B. GABA. C. Serotonin. D. Acetylcholine. Answer. C. Serotonin. Rationale. Serotonin plays a major role in mood regulation, and its deficiency is linked to depression. 38. Which statement by a patient with borderline personality disorder, BPD, suggests improvement? A. I still feel empty, but I know it will pass. B. Everyone either loves me or hates me. C. I always get abandoned in relationships. D. I don't care what anyone thinks. Answer. A. I still feel empty, but I know it will pass. Rationale. Recognizing and tolerating distressing emotions is a sign of improvement in BPD. 39. Which intervention is most effective for a patient with OCD who engages in excessive hand-washing? A. Forcing the patient to stop washing hands. B. Encouraging gradual exposure therapy. C. Ignoring the compulsion. D. Telling the patient the behavior is illogical. Answer. B. Encouraging gradual exposure therapy. Rationale. Exposure therapy helps patients manage compulsions without increasing anxiety. 40. A patient states, I have nothing to live for anymore. What is the nurse's priority action? A. Ask if the patient has a specific suicide plan. B. Offer reassurance that life will get better. C. Encourage the patient to talk to friends. D. Suggest the patient engage in a hobby. Answer. A. Ask if the patient has a specific suicide plan. Rationale. Assessing suicide risk is the priority intervention. 41. A nurse is caring for a patient with dissociative identity disorder. What is the priority intervention? A. Encourage the patient to recall traumatic memories. B. Establish trust and safety. C. Ask the patient to ignore alternate personalities. D. Confront the patient about inconsistencies in their story. Answer. B. Establish trust and safety. Rationale: safety and trust building are essential before addressing trauma in dissociative disorders. 42. A patient taking lithium reports severe diarrhea and tremors. What should the nurse do first? A. Reassure the patient these are normal side effects. B. Give an antidiarrheal medication. C. Check lithium levels immediately. D. Increase the patient's fluid intake. Answer: C. Check lithium levels immediately. Rationale: these are signs of lithium toxicity, requiring urgent assessment. 43. Which behavior is most characteristic of narcissistic personality disorder? A. Intense fear of abandonment. B. Grandiose sense of self-importance. C. Unstable mood swings. D. Preoccupation with order and perfection. Answer: B. Grandiose sense of self-importance. Rationale: narcissistic personality disorder is characterized by arrogance and an inflated sense of self-worth. 44. A nurse is teaching a patient with panic disorder. What is the best initial intervention during an attack? A. Encourage deep breathing. B. Tell the patient to calm down. C. Ask the patient to discuss their fears. D. Explain the long-term effects of anxiety. Answer: A. Encourage deep breathing. Rationale: deep breathing helps regulate the autonomic response and reduce panic symptoms. 45. Which neurotransmitter imbalance is associated with schizophrenia? A. Increased serotonin. B. Decreased dopamine. C. Increased dopamine. D. Decreased norepinephrine. Answer: C. Increased dopamine. Rationale: excess dopamine is linked to schizophrenia symptoms. 46. A patient with major depressive disorder starts taking an SSRI. When is the highest risk for suicide? A. Immediately after starting the medication. B. 1 to 2 weeks after starting the medication. C. 3 to 6 months into treatment. D. After full remission. Answer: B. 1 to 2 weeks after starting the medication. Rationale: energy levels improve before mood does, increasing suicide risk. 47. A patient with bipolar disorder is prescribed lithium. What should be included in patient education? A. Limit fluid intake. B. Avoid excessive sodium intake. C. Take the medication only during manic episodes. D. You will need frequent blood tests. Answer: D. You will need frequent blood tests. Rationale: lithium requires regular monitoring to prevent toxicity. 48. A nurse is caring for a patient with PTSD. Which therapy is most effective? A. Exposure therapy. B. Psychoanalysis. C. Hypnotherapy. D. Psychodynamic therapy. Answer: A. Exposure therapy. Rationale: exposure therapy helps patients process and reduce trauma-related distress. 49. Which symptom is most indicative of opioid withdrawal? A. Respiratory depression. B. Increased heart rate and sweating. C. Pinpoint pupils. D. Decreased bowel sounds. Answer: B. Increased heart rate and sweating. Rationale: opioid withdrawal includes autonomic hyperactivity, e.g., tachycardia, sweating. 50. A nurse is assessing a patient with anorexia nervosa. What is an expected lab finding? A. Hyperkalemia. B. Hypocalcemia. C. Hypokalemia. D. Hypernatremia. Answer: C. Hypokalemia. Rationale: starvation and purging lead to low potassium levels. 51. A patient is experiencing akathisia due to an antipsychotic. What is the best intervention? A. Lower the antipsychotic dose. B. Administer a beta blocker. C. Increase the antipsychotic dose. D. Encourage relaxation techniques. Answer: B. Administer a beta blocker. Rationale: beta blockers like propranolol can help relieve akathisia. 52. A nurse is caring for a patient with paranoid schizophrenia. Which response is most therapeutic? A. I don't see anyone watching you. B. You're imagining things again. C. That must be scary. You're safe here. D. Let's not talk about that right now. Answer: C. That must be scary. You are safe here. Rationale: validating emotions while providing reassurance is therapeutic. 53. Which patient statement suggests obsessive-compulsive disorder? A. I hear voices telling me to do things. B. I have to check my door lock 10 times before sleeping. C. I feel hopeless all the time. D. I avoid social gatherings because of anxiety. Answer: B. I have to check my door lock 10 times before sleeping. Rationale: repetitive, compulsive behaviors are characteristic of OCD. 54. A nurse is caring for a patient in alcohol withdrawal. What is the priority assessment? A. Depression symptoms. B. Blood pressure and heart rate. C. Level of motivation for sobriety. D. Suicidal ideation. Answer: B. Blood pressure and heart rate. Rationale: alcohol withdrawal can cause life-threatening hypertension and tachycardia. 55. A patient with borderline personality disorder engages in self-harm. What is the priority nursing intervention? A. Set firm limits on behavior. B. Teach emotion regulation skills. C. Encourage the patient to talk about childhood trauma. D. Provide constant supervision. Answer: D. Provide constant supervision. Rationale: immediate safety is the priority in self-harm cases. 56. Which finding suggests neuroleptic malignant syndrome, NMS? A. Muscle rigidity, high fever, confusion. B. Hypotension, sedation, dry mouth. C. Tremors, restlessness, tachycardia. D. Hallucinations, paranoia, sweating. Answer: A. Muscle rigidity, high fever, confusion. Rationale: NMS is a life-threatening reaction to antipsychotics requiring emergency intervention. 57. A patient with generalized anxiety disorder is prescribed buspirone. What should the nurse include in teaching? A. This medication works immediately. B. Avoid alcohol while taking this medication. C. Take this medication as needed for anxiety. D. You will need routine blood tests. Answer: B. Avoid alcohol while taking this medication. Rationale: buspirone should not be taken with alcohol, but it does not require routine blood tests. 58. A nurse is assessing a patient with ADHD. Which symptom is most characteristic? A. Hallucinations. B. Distractibility and impulsivity. C. Poor appetite. D. Excessive sleeping. Answer: B. Distractibility and impulsivity. Rationale: ADHD is marked by inattention, hyperactivity, and impulsivity. 59. A patient states, I want to die, but I have no plan. What is the best nursing intervention? A. Place the patient in seclusion. B. Ask about protective factors. C. Ignore the statement since there is no plan. D. Give the patient privacy. Answer: B. Ask about protective factors. Rationale: assessing protective factors, e.g., support system, reasons for living, helps determine risk level. 60. A patient experiencing a manic episode is pacing the unit and talking loudly. What is the priority intervention? A. Offer a quiet environment. B. Tell the patient to stop pacing. C. Allow the patient to pace uninterrupted. D. Provide a detailed explanation of their behavior. Answer: A. Offer a quiet environment. Rationale: a calm, low-stimulation environment helps de-escalate mania. 61. A nurse is caring for a patient with major depressive disorder. Which intervention is most appropriate? A. Encourage isolation to promote rest. B. Allow the patient to stay in bed all day. C. Encourage participation in simple activities. D. Provide frequent snacks instead of meals. Answer: C. Encourage participation in simple activities. Rationale: engaging in small activities can help improve mood and prevent withdrawal. 62. Which medication is most commonly used to treat alcohol withdrawal? A. Haloperidol. B. Lorazepam. C. Lithium. D. Fluoxetine. Answer: B. Lorazepam. Rationale: benzodiazepines like lorazepam help prevent seizures and agitation in alcohol withdrawal. 63. A patient with schizophrenia refuses to take medication, stating, "The government is trying to poison me." What is the nurse's best response? A. That's not true. You need to take your medicine. B. I understand that you're scared, but the medication will help you feel better. C. If you don't take this, you will be restrained. D. Let's not talk about that right now. Answer: B. I understand that you're scared, but the medication will help you feel better. Rationale: acknowledging fear while gently encouraging treatment promotes trust. 64. Which food should a patient avoid when taking an MAOI? A. Bananas. B. Chicken. C. Cheese. D. Rice. Answer: C. Cheese. Rationale: MAOIs interact with tyramine-rich foods like aged cheese, causing hypertensive crisis. 65. A nurse is teaching a patient about fluoxetine. Which statement indicates understanding? A. I can stop taking this medication once I feel better. B. I should avoid alcohol while taking this medication. C. This medication may cause high blood pressure. D. I will take this medication at night to help me sleep. Answer: B. I should avoid alcohol while taking this medication. Rationale: alcohol can increase side effects and should be avoided. 66. A patient with antisocial personality disorder is manipulative. What is the best nursing approach? A. Set firm, consistent limits. B. Allow the patient to have their way to avoid conflict. C. Avoid discussing consequences of behavior. D. Offer special privileges for good behavior. Answer: A. Set firm, consistent limits. Rationale: clear boundaries prevent manipulation and reinforce appropriate behavior. 67. A patient with PTSD is experiencing a flashback. What should the nurse do first? A. Encourage the patient to describe the trauma in detail. B. Remind the patient they are in a safe place. C. Ask the patient to stop the flashback. D. Leave the patient alone to calm down. Answer: B. Remind the patient they are in a safe place. Rationale: grounding techniques help reorient the patient to reality. 68. Which symptom is most indicative of serotonin syndrome? A. Hyperreflexia and fever. B. Constipation and bradycardia. C. Hypotension and confusion. D. Dry mouth and urinary retention. Answer: A. Hyperreflexia and fever. Rationale: serotonin syndrome presents with neuromuscular and autonomic instability. 69. A nurse is assessing a patient with opioid intoxication. Which finding is expected? A. Dilated pupils. B. Hypertension. C. Respiratory depression. D. Agitation. Answer: C. Respiratory depression. Rationale: opioids depress the central nervous system, leading to slow breathing. 70. Which medication is used to reverse benzodiazepine overdose? A. Naloxone. B. Flumazenol. C. Methadone. D. Haloperidol. Answer: B. Flumazenol. Rationale: flumazenol is a benzodiazepine antagonist. 71. A nurse is caring for a patient with anorexia nervosa. Which intervention is a priority? A. Allow the patient to exercise to reduce anxiety. B. Weigh the patient daily after meals. C. Supervise the patient during and after meals. D. Let the patient choose their meal portions. Answer: C. Supervise the patient during and after meals. Rationale: monitoring prevents purging behaviors. 72. A patient with schizophrenia is experiencing command hallucinations. What is the priority action? A. Ask what the voices are saying. B. Tell the patient to ignore the voices. C. Provide a distraction like music. D. Encourage the patient to rest. Answer: A. Ask what the voices are saying. Rationale: assessing hallucinations helps determine risk, e.g., self-harm or harm to others. 73. Which side effect should a nurse monitor for in a patient taking clozapine? A. Hypertension. B. Agranulocytosis. C. Weight loss. D. Insomnia. Answer: B. Agranulocytosis. Rationale: clozapine can cause life-threatening decreases in white blood cells. 74. A patient with bipolar disorder is prescribed valproate. What labs should the nurse monitor? A. Liver function tests. B. Platelet count. C. Electrolytes. D. Blood glucose. Answer: A. Liver function tests. Rationale: valproate can cause hepatotoxicity. 75. A nurse is caring for a patient with OCD who washes their hands repeatedly. What is the best intervention? A. Allow unlimited hand washing to reduce anxiety. B. Interrupt the behavior and redirect immediately. C. Encourage gradual time limits on hand washing. D. Ignore the behavior. Answer: C. Encourage gradual time limits on hand washing. Rationale: gradual exposure helps reduce compulsions. 76. A patient with borderline personality disorder frequently threatens self-harm. What is the best approach? A. Ignore the threats to discourage attention-seeking. B. Provide one-on-one supervision when threats occur. C. Give positive reinforcement for threats. D. Allow the patient to discuss self-harm freely. Answer: B. Provide one-on-one supervision when threats occur. Rationale: ensuring safety is the priority. 77. A nurse is caring for a patient with alcohol use disorder. Which statement suggests readiness for change? A. I can stop drinking anytime I want. B. I drink because my life is stressful. C. I want to stop drinking, but I don't think I can. D. I need help to stop drinking. Answer: D. I need help to stop drinking. Rationale: acknowledging the need for help indicates readiness for change. 78. A nurse is assessing a patient with opioid withdrawal. Which symptom is expected? A. Bradycardia. B. Severe hypertension. C. Muscle aches and yawning. D. Respiratory depression. Answer: C. Muscle aches and yawning. Rationale: opioid withdrawal includes flu-like symptoms. 79. A nurse is teaching a patient about buspirone. Which statement requires further teaching? A. I will take this medication daily for anxiety. B. I can take this medication as needed. C. This medication does not cause dependence. D. It may take a few weeks to start working. Answer: B. I can take this medication as needed. Rationale: buspirone is not a PRN medication. It requires consistent use. 80. A patient with schizophrenia believes the FBI is following them. What is the most therapeutic response? A. You are imagining things. That's not true. B. It sounds like you feel unsafe. Tell me more. C. The FBI is not interested in you. D. Don't worry. You are safe in the hospital. Answer: B. It sounds like you feel unsafe. Tell me more. Rationale: acknowledging feelings while not reinforcing the delusion is therapeutic. 81. A nurse is assessing a patient taking lithium. Which symptom requires immediate intervention? A. Mild hand tremors. B. Increased thirst. C. Nausea and diarrhea. D. Slurred speech and confusion. Answer: D. Slurred speech and confusion. Rationale: these are signs of lithium toxicity, requiring immediate intervention. 82. A patient with depression is prescribed sertraline. What should the nurse teach about this medication? A. You will feel better within 24 hours. B. Avoid taking this medication with MALIs. C. This medication may cause weight loss. D. It can be stopped abruptly if needed. Answer: B. Avoid taking this medication with MAOIs. Rationale: combining SSRIs with MAOIs can cause serotonin syndrome. 83. A patient with schizophrenia has flat affect and social withdrawal. What is the best nursing intervention? A. Encourage group therapy participation. B. Confront the patient about their withdrawal. C. Avoid interacting with the patient unless necessary.
D. Tell the patient they need to be more expressive.
Answer: A. Encourage group therapy participation. Rationale: group therapy helps improve social skills and interaction. 84. A nurse is caring for a patient with panic disorder. What should the nurse do during a panic attack? A. Encourage deep breathing and a calm environment. B. Leave the patient alone to calm down. C. Ask the patient to describe their panic in detail. D. Provide caffeine to increase alertness. Answer: A. Encourage deep breathing and a calm environment. Rationale: deep breathing helps reduce anxiety and promotes relaxation. 85. Which statement by a patient taking haloperidol requires immediate action? A. My hands are trembling slightly. B. I feel restless and can't sit still. C. My tongue feels thick and I can't swallow. D. I feel tired after taking my medication. Answer: C. My tongue feels thick and I can't swallow. Rationale: these are signs of a dystonic reaction requiring immediate intervention. 86. A nurse is assessing a patient with anorexia nervosa. Which finding is expected? A. Hypertension. B. Bradycardia. C. Hyperglycemia. D. Weight gain. Answer: B. Bradycardia. Rationale: anorexia can cause slow heart rate due to malnutrition. 87. A patient with bipolar disorder is in a manic episode. What is the priority nursing intervention? A. Encourage long discussions about their thoughts. B. Provide a quiet, structured environment. C. Offer high-fat, sugary foods to maintain energy. D. Allow the patient to direct their own care. Answer: B. Provide a quiet, structured environment. Rationale: a calm environment helps reduce overstimulation. 88. Which side effect should be monitored in a patient taking risperidone? A. Insomnia. B. Hypoglycemia. C. Weight gain. D. Tachycardia. Answer: C. Weight gain. Rationale: atypical antipsychotics like risperidone can cause metabolic syndrome. 89. A nurse is assessing a patient withdrawing from alcohol. Which symptom is most concerning? A. Mild tremors. B. Nausea and vomiting. C. Diaphoresis. D. Hallucinations. Answer: D. Hallucinations. Rationale: hallucinations indicate severe withdrawal and risk for delirium tremens. 90. A patient with obsessive-compulsive disorder washes their hands repeatedly. What should the nurse do? A. Allow unlimited hand washing. B. Encourage alternative coping mechanisms. C. Restrain the patient to stop the behavior. D. Ignore the behavior. Answer: B. Encourage alternative coping mechanisms. Rationale: providing alternatives helps manage compulsions. 91. A nurse is teaching about alprazolam. Which statement indicates understanding? A. I can drink alcohol with this medication. B. I should take this medication only as prescribed. C. This medication will cure my anxiety. D. I can stop taking it suddenly if I feel better. Answer: B. I should take this medication only as prescribed. Rationale: benzodiazepines must be taken as directed to prevent dependence. 92. A patient taking clozapine reports sore throat and fever. What is the nurse's priority action? A. Encourage rest and fluids. B. Monitor for signs of infection. C. Assess for agranulocytosis. D. Reassure the patient it's a common side effect. Answer: C. Assess for agranulocytosis. Rationale: clozapine can cause agranulocytosis, a serious side effect. 93. A nurse is assessing a patient with PTSD. Which symptom is expected? A. Increased energy and excitability. B. Repeated reliving of the trauma. C. Disorganized speech. D. Lack of emotional response. Answer: B. Repeated reliving of the trauma. Rationale: PTSD involves intrusive memories and flashbacks. 94. A patient with schizophrenia states, "The sun is singing to me." This is an example of what? A. Hallucination. B. Delusion. C. Flight of ideas. D. Thought blocking. Answer: B. Delusion. Rationale: a false belief, e.g., personifying the sun, is a delusion. 95. A patient taking lithium has a level of 2.2 milliequivalent/L. What is the nurse's priority action? A. Encourage fluid intake. B. Administer activated charcoal. C. Hold the medication and notify the provider. D. Reassess the level in 24 hours. Answer: C. Hold the medication and notify the provider. Rationale: levels above 1.5 milliequivalent/L indicate toxicity, requiring immediate intervention. 96. A nurse is caring for a patient with major depressive disorder. Which intervention is most appropriate? A. Encourage complete bed rest. B. Allow the patient to skip meals if they aren't hungry. C. Involve the patient in structured activities. D. Avoid discussing their feelings to prevent distress. Answer: C. Involve the patient in structured activities. Rationale: structured activities can help improve mood and motivation. 97. A patient taking an MAOI should avoid which food? A. Chicken. B. Cheese. C. Apples. D. Rice. Answer: B. Cheese. Rationale: tyramine-rich foods like cheese can cause hypertensive crisis. 98. A patient with borderline personality disorder frequently self-harms. What is the best nursing approach? A. Set clear limits and provide emotional support. B. Ignore the self-harming behavior. C. Punish the patient for self-harm. D. Allow the behavior to continue. Answer: A. Set clear limits and provide emotional support. Rationale: clear boundaries and support help prevent self-harm. 99. A patient with schizophrenia refuses medication, stating it's poison. What should the nurse do? A. Force the patient to take it. B. Provide education and offer alternative options. C. Ignore the refusal. D. Discharge the patient immediately. Answer: B. Provide education and offer alternative options. Rationale: providing information and alternatives can encourage compliance. 100. A patient taking fluoxetine reports increased energy but still feels depressed. What is the priority action? A. Encourage the patient to increase socialization. B. Assess for suicidal thoughts. C. Advise the patient to stop taking the medication. D. Increase the medication dosage. Answer: B. Assess for suicidal thoughts. Rationale: increased energy with ongoing depression may indicate suicide risk. Auditory hallucinations. What is the best nursing response? A. I don't hear any voices. You must be imagining it. B. What are the voices telling you? C. Ignore the voices, they aren't real. D. Try listening to music to block out the voices. Answer: B. What are the voices telling you? Rationale: assessing the content of hallucinations helps determine safety risks. 102. A patient taking a benzodiazepine reports drowsiness. What should the nurse do? A. Stop the medication immediately. B. Educate the patient that this is a common side effect. C. Increase the medication dosage. D. Suggest taking it with alcohol to reduce sedation. Answer: B. Educate the patient that this is a common side effect. Rationale: drowsiness is a common side effect of benzodiazepines. 103. Which intervention is most important for a patient in alcohol withdrawal? A. Monitor for seizures and hallucinations. B. Encourage high-protein meals. C. Allow the patient to withdraw without intervention. D. Provide unlimited access to fluids. Answer: A. Monitor for seizures and hallucinations. Rationale: alcohol withdrawal can lead to seizures and delirium tremens. 104. A patient with major depressive disorder is refusing to get out of bed. What is the best approach? A. You need to get up or you'll be punished. B. I understand you feel down, but let's sit up together for a bit. C. Stay in bed until you feel ready to get up. D. If you don't get up, I will call your doctor. Answer: B. I understand you feel down, but let's sit up together for a bit. Rationale: gentle encouragement helps improve motivation. 105. A patient with obsessive-compulsive disorder washes their hands 30 times an hour. What should the nurse do? A. Stop the patient immediately. B. Encourage alternative coping strategies. C. Allow unlimited hand washing. D. Ignore the behavior. Answer: B. Encourage alternative coping strategies. Rationale: teaching alternative coping mechanisms helps reduce compulsions. 106. Which symptom is most concerning in a patient taking clozapine? A. Mild dizziness. B. Sore throat and fever. C. Dry mouth. D. Mild tremors. Answer: B. Sore throat and fever. Rationale: these can indicate agranulocytosis, a serious side effect. 107. A nurse is assessing a patient with PTSD. Which symptom is expected? A. Disorganized speech. B. Flashbacks and nightmares. C. Increased socialization. D. Lack of memory of the traumatic event. Answer: B. Flashbacks and nightmares. Rationale: PTSD involves re-experiencing trauma. 108. A patient with borderline personality disorder threatens self-harm. What is the nurse's best action? A. Ignore the statement. B. Set clear limits while ensuring safety. C. Punish the patient for their behavior. D. Allow the behavior to continue. Answer: B. Set clear limits while ensuring safety. Rationale: boundaries help manage self-harm behaviors. 109. A nurse is assessing a patient with bipolar disorder in a manic episode. What is the priority intervention? A. Allow the patient to lead group discussions. B. Provide a calm, structured environment. C. Encourage long, detailed conversations. D. Avoid interacting with the patient. Answer: B. Provide a calm, structured environment. Rationale: a structured environment helps reduce overstimulation. 110. A patient on fluoxetine reports new-onset restlessness and sweating. What is the nurse's priority action? A. Monitor for serotonin syndrome. B. Stop the medication immediately. C. Encourage deep breathing exercises. D. Increase the medication dosage. Answer: A. Monitor for serotonin syndrome. Rationale: restlessness and sweating may indicate serotonin syndrome. 111. Which statement by a patient taking lithium requires intervention? A. I should drink plenty of water. B. I should avoid sudden dietary changes in salt intake. C. I can take ibuprofen for headaches. D. I will have regular blood tests for monitoring. Answer: C. I can take ibuprofen for headaches. Rationale: NSAIDs like ibuprofen can increase lithium toxicity. 112. A patient with schizophrenia refuses to take medication, saying, "It's poison." What is the nurse's best response? A. This medication will help with your symptoms. B. If you don't take it, you will be restrained. C. You have to take it because I said so. D. I will give you double the dose next time. Answer: A. This medication will help with your symptoms. Rationale: providing education may improve compliance. 113. Which diet is best for a patient with mania? A. High-calorie finger foods. B. Low-protein meals. C. Heavy, large meals. D. Spicy foods. Answer: A. High-calorie finger foods. Rationale: manic patients may not sit down for meals, so easy-to-eat foods are best. 114. A patient taking an MAOI should avoid which beverage? A. Orange juice. B. Milk. C. Red wine. D. Water. Answer: C. Red wine. Rationale: tyramine-containing foods like red wine can cause hypertensive crisis. 115. A patient with social anxiety disorder is starting a new job. What intervention is best? A. Encourage practicing social skills. B. Suggest avoiding social interactions. C. Recommend staying at home. D. Advise quitting the job. Answer: A. Encourage practicing social skills. Rationale: practicing social interactions helps reduce anxiety. 116. Which statement by a patient taking haloperidol requires immediate intervention? A. I feel restless and can't stop moving. B. I feel a little sleepy. C. My throat feels tight and I can't swallow. D. I have mild dry mouth. Answer: C. My throat feels tight and I can't swallow. Rationale: this indicates a dystonic reaction requiring immediate treatment. 117. A patient with depression is prescribed sertraline. What should the nurse teach? A. You will feel better within a few hours. B. Avoid stopping the medication abruptly. C. You won't need follow-up appointments. D. It's okay to drink alcohol while taking this. Answer: B. Avoid stopping the medication abruptly. Rationale: stopping SSRIs suddenly can cause withdrawal symptoms. 118. A patient with schizophrenia says, "The government is controlling my thoughts." This is an example of A. Hallucination. B. Delusion. C. Flight of ideas. D. Thought blocking. Answer: B. Delusion. Rationale: a false belief of mind control is a delusion. 119. A patient with generalized anxiety disorder reports feeling overwhelmed. What is the best nursing intervention? A. Encourage deep breathing exercises. B. Suggest ignoring their feelings. C. Tell the patient to just relax. D. Recommend consuming caffeine. Answer: A. Encourage deep breathing exercises. Rationale: deep breathing helps manage anxiety. 120. A patient in a psychiatric unit starts shouting angrily. What should the nurse do first? A. Speak calmly and set limits. B. Restrain the patient immediately. C. Shout back at the patient. D. Ignore the behavior. Answer: A. Speak calmly and set limits. Rationale: a calm approach helps de-escalate agitation. 121. A nurse is caring for a patient with severe anxiety. What is the first priority? A. Encourage problem solving. B. Promote deep breathing techniques. C. Provide detailed education. D. Ask the patient to make important decisions. Answer: B. Promote deep breathing techniques. Rationale: deep breathing helps reduce acute anxiety symptoms. 122. A patient with bipolar disorder is in a depressive episode. What intervention is most helpful? A. Encourage social isolation. B. Promote physical activity and structure. C. Ignore the patient's concerns. D. Increase environmental stimulation. Answer: B. Promote physical activity and structure. Rationale: routine and activity help manage depressive symptoms. 123. Which of the following is a negative symptom of schizophrenia? A. Hallucinations. B. Delusions. C. Social withdrawal. D. Disorganized speech. Answer: C. Social withdrawal. Rationale: negative symptoms include social withdrawal, apathy, and lack of motivation. 124. A patient taking risperidone reports dizziness when standing up. What should the nurse do? A. Stop the medication immediately. B. Encourage slow position changes. C. Increase fluid intake. D. Suggest avoiding medication at night. Answer: B. Encourage slow position changes. Rationale: risperidone can cause orthostatic hypotension. 125. A patient with anorexia nervosa has a BMI of 16. What is the priority nursing intervention? A. Encourage daily exercise. B. Provide nutritional support. C. Discuss weight loss goals. D. Allow unrestricted food choices. Answer: B. Provide nutritional support. Rationale: restoring nutritional balance is the primary goal. 126. A patient with panic disorder is hyperventilating. What is the best response? A. Try to slow your breathing with me. B. Just stop overreacting. C. Focus on something else and ignore it. D. Panic attacks are not real, calm down. Answer: A. Try to slow your breathing with me. Rationale: guiding controlled breathing helps reduce symptoms. 127. A patient taking lithium has nausea, vomiting, and tremors. What is the nurse's priority action? A. Administer an antiemetic. B. Check lithium levels. C. Encourage fluid intake. D. Reassure the patient that this is normal. Answer. B. Check lithium levels. Rationale. Symptoms suggest lithium toxicity. 128. A patient with PTSD avoids crowds and refuses to leave home. What is the best intervention? A. Encourage gradual exposure to public places. B. Force the patient into a crowded area. C. Tell the patient to just get over it. D. Ignore the behavior. Answer. A. Encourage gradual exposure to public places. Rationale. Gradual exposure helps desensitize fear responses. 129. A patient with schizophrenia has a flat affect and does not respond to stimuli. What is the best nursing approach? A. Use simple, direct communication. B. Encourage elaborate responses. C. Avoid all interactions. D. Expect immediate changes in behavior. Answer. A. Use simple, direct communication. Rationale. Clear, simple communication is effective for negative symptoms. 130. A patient taking fluoxetine reports increased energy, but still has suicidal thoughts. What is the priority nursing action? A. Increase the medication dose. B. Assess suicide risk and safety. C. Encourage social interactions. D. Tell the patient to ignore the thoughts. Answer. B. Assess suicide risk and safety. Rationale. Increased energy may raise suicide risk and depression. 131. A patient with alcohol use disorder reports hand tremors and nausea. What is the priority intervention? A. Monitor for withdrawal symptoms. B. Offer counseling sessions. C. Encourage a high-sugar diet. D. Provide unlimited fluids. Answer. A. Monitor for withdrawal symptoms. Rationale. Alcohol withdrawal can lead to seizures and delirium tremens. 132. A patient with schizophrenia states, I hear voices telling me to hurt myself. What is the priority action? A. Ignore the statement. B. Assess for suicidal risk and safety. C. Tell the patient to ignore the voices. D. Change the subject. Answer. B. Assess for suicidal risk and safety. Rationale. Hallucinations commanding self-harm require immediate safety assessment. 133. A patient experiencing a manic episode is pacing nonstop. What should the nurse do? A. Provide high-calorie snacks and fluids. B. Ask the patient to sit down immediately. C. Encourage group discussions. D. Allow unrestricted activity. Answer. A. Provide high-calorie snacks and fluids. Rationale. Manic patients burn excess energy and need nutrition. 134. Which patient statement suggests narcissistic personality disorder? A. I always feel empty and afraid of abandonment. B. I deserve special treatment because I'm the best. C. I prefer to be alone and avoid socializing. D. I always think people are out to harm me. Answer. B. I deserve special treatment because I'm the best. Rationale. Grandiosity and entitlement are key traits. 135. A patient with dependent personality disorder needs to make a small decision, but refuses. What is the best nursing approach? A. Encourage the patient to make a choice. B. Make the decision for them. C. Allow complete avoidance of decisions. D. Punish the patient for indecisiveness. Answer. A. Encourage the patient to make a choice. Rationale. Supporting decision-making fosters independence. 136. A patient on haloperidol develops a rigid posture, fever, and confusion. What is the priority action? A. Administer acetaminophen. B. Stop the medication and notify the provider. C. Encourage hydration. D. Reassure the patient that this is normal. Answer. B. Stop the medication and notify the provider. Rationale. Symptoms suggest neuroleptic malignant syndrome, a medical emergency. 137. A patient with social anxiety disorder avoids eye contact and speaks softly. What is the best nursing intervention? A. Encourage gradual social interaction. B. Force the patient into a large group setting. C. Ignore the behavior. D. Discourage communication. Answer. A. Encourage gradual social interaction. Rationale. Gradual exposure builds confidence. 138. Which statement by a patient taking benzodiazepines requires further teaching? A. I should avoid alcohol while taking this medication. B. I can stop taking this medication whenever I feel better. C. This medication helps with my anxiety. D. I may feel sleepy after taking this medication. Answer. B. I can stop taking this medication whenever I feel better. Rationale. Abrupt discontinuation can cause withdrawal symptoms. 139. A patient with paranoid schizophrenia refuses to eat, stating, "The food is poisoned." What is the best response? A. I understand you feel that way, but the food is safe. B. Stop being paranoid and just eat. C. You have to eat or you'll be force-fed. D. Ignore the food and focus on something else. Answer. A. I understand you feel that way, but the food is safe. Rationale. Acknowledging concerns while providing reassurance promotes trust. 140. A nurse is evaluating a patient with depression. Which statement suggests improvement? A. I still don't want to get out of bed. B. I have started going for short walks daily. C. I can't concentrate on anything. D. Nothing will ever get better for me. Answer. B. I have started going for short walks daily. Rationale. Increased activity and motivation indicate improvement. 141. A nurse is caring for a patient with borderline personality disorder. Which behaviors should the nurse expect? A. Difficulty maintaining relationships. B. Consistent mood stability. C. Rigid adherence to rules. D. Lack of emotional reactions. Answer. A. Difficulty maintaining relationships. Rationale. Borderline personality disorder is characterized by unstable relationships and emotions. 142. A patient with major depressive disorder states, "I don't want to live anymore." What is the nurse's priority action? A. Administer the prescribed antidepressant. B. Ask the patient if they have a plan for suicide. C. Provide a distraction to change the subject. D. Encourage the patient to rest and sleep. Answer. B. Ask the patient if they have a plan for suicide. Rationale. Assessing the presence of a suicide plan is critical for safety. 143. A nurse is caring for a patient who is experiencing a panic attack. Which intervention is most effective? A. Encourage the patient to express feelings. B. Stay with the patient and provide reassurance. C. Suggest that the patient take a nap. D. Limit interaction with the patient. Answer. B. Stay with the patient and provide reassurance. Rationale. Being present and offering reassurance helps the patient feel safe during a panic attack. 144. A patient with schizophrenia is prescribed clozapine. What is a priority nursing consideration? A. Monitor for signs of hypotension. B. Monitor for signs of agranulocytosis. C. Encourage increased fluid intake. D. Monitor for signs of dehydration. Answer. B. Monitor for signs of agranulocytosis. Rationale. Clozapine can cause agranulocytosis, a life-threatening condition. 145. A patient with bipolar disorder is experiencing a manic episode. What is the best nursing intervention? A. Encourage physical activity to release energy. B. Provide a quiet, structured environment. C. Increase social interactions with other patients. D. Allow the patient to express all feelings. Answer. B. Provide a quiet, structured environment. Rationale. A structured, calm environment helps prevent overstimulation during mania. 146. Which of the following medications is commonly prescribed for the treatment of generalized anxiety disorder? A. Olanzapine. B. Lorazepam. C. fluoxetine. D. Lithium. Answer: B. Lorazepam. Rationale: lorazepam, a benzodiazepine, is commonly used to treat anxiety. 147. A patient with alcohol withdrawal is at risk for delirium tremens. Which of the following is a priority nursing intervention? A. Administer prescribed benzodiazepines. B. Encourage hydration with electrolyte solutions. C. Provide a high-calorie, high-protein diet. D. Monitor for signs of hyperglycemia. Answer: A. Administer prescribed benzodiazepines. Rationale: benzodiazepines reduce the risk of delirium tremens and seizures during alcohol withdrawal. 148. A patient with post-traumatic stress disorder, PTSD, frequently relives a traumatic event. Which of the following should the nurse include in the care plan? A. Encourage the patient to avoid talking about the trauma. B. Provide a quiet environment with minimal stimuli. C. Promote re-exposure to the traumatic event. D. Teach grounding techniques to prevent flashbacks. Answer: D. Teach grounding techniques to prevent flashbacks. Rationale: grounding techniques help prevent flashbacks and manage PTSD symptoms. 149. A nurse is educating a patient about the use of selective serotonin reuptake inhibitors, SSRIs. Which statement by the patient indicates a need for further teaching? A. It may take a few weeks for the medication to work. B. I should avoid drinking alcohol while taking this medication. C. This medication is addictive, so I can stop anytime. D. I may experience some side effects like nausea initially. Answer: C. This medication is addictive, so I can stop anytime. Rationale: SSRIs are not addictive, and stopping the medication abruptly can cause withdrawal symptoms. 150. A patient with narcissistic personality disorder refuses to share their diagnosis with family members. How should the nurse respond? A. Tell the patient that it is essential for family involvement. B. Respect the patient's wish to keep the diagnosis confidential. C. Insist that the family must be informed for the patient's safety. D. Tell the family about the diagnosis without the patient's consent. Answer: B. Respect the patient's wish to keep the diagnosis confidential. Rationale: the nurse must respect the patient's privacy and autonomy within ethical guidelines. 151. A patient diagnosed with schizophrenia refuses to take their prescribed antipsychotic medication. What is the nurse's priority intervention? A. Discuss the benefits of the medication. B. Respect the patient's decision not to take the medication. C. Administer the medication covertly. D. Ask the patient why they are refusing the medication. Answer: A. Discuss the benefits of the medication. Rationale: educating the patient on the benefits of medication can help address their concerns and promote compliance. 152. A nurse is caring for a patient with obsessive-compulsive disorder, OCD. Which intervention is most effective in managing the patient's compulsive behaviors? A. Ignore the compulsions to reduce attention to them. B. Encourage the patient to perform the compulsions in private. C. Support the patient in gradually reducing compulsive behaviors. D. Discourage the patient from performing any compulsions. Answer: C. Support the patient in gradually reducing compulsive behaviors. Rationale: gradual reduction of compulsions is a key part of treating OCD. 153. A patient with a history of self-harm is being admitted to the psychiatric unit. What is the nurse's priority action? A. Ask the patient about their triggers for self-harm. B. Remove any potentially harmful objects from the room. C. Offer emotional support and reassurance. D. Give the patient time alone to calm down. Answer: B. Remove any potentially harmful objects from the room. Rationale: ensuring a safe environment is the priority to prevent self-harm. 154. A patient with bipolar disorder in a manic phase insists on staying awake for several days. What is the nurse's primary concern? A. The patient's risk of dehydration. B. The patient's risk of injury due to poor judgment. C. The patient's need for medication adjustment. D. The patient's desire for social interaction. Answer: B. the patient's risk of injury due to poor judgment. Rationale: during mania, impaired judgment and impulsivity increase the risk of harm. 155. A nurse is caring for a patient diagnosed with dissociative identity disorder, DID. Which of the following is the most appropriate intervention? A. Reinforce the patient's identity and encourage full integration of personalities. B. Ignore the alternate personalities and focus on the primary identity. C. Provide support to help the patient understand the different personalities. D. Confront the patient's alternate personalities about their behaviors. Answer: C. Provide support to help the patient understand the different personalities. Rationale: supporting the patient in understanding and managing the different personalities promotes therapeutic progress. 156. A nurse is educating a patient about taking lithium for bipolar disorder. Which statement indicates that the patient understands the instructions? A. I will take my lithium only when I feel manic. B. I should have my lithium levels checked regularly. C. I can stop taking lithium if I feel fine. D. I should avoid drinking plenty of water while on lithium. Answer: B. I should have my lithium levels checked regularly. Rationale: regular monitoring of lithium levels is essential to avoid toxicity. 157. A patient with schizophrenia is exhibiting delusions of persecution. How should the nurse respond? A. Argue with the patient to challenge the delusion. B. Agree with the delusion to avoid confrontation. C. Acknowledge the delusion and gently redirect the conversation. D. Ignore the delusion to prevent reinforcement. Answer: C. Acknowledge the delusion and gently redirect the conversation. Rationale: acknowledging the delusion and redirecting helps maintain rapport without reinforcing the false belief. 158. A nurse is teaching a group of patients about assertiveness training. Which of the following is an example of an assertive response? A. I don't want to go, but I'll go anyway. B. I don't like this, but I'll do it because you want me to. C. I prefer not to, but I can do it if needed. D. I don't want to go, and I'm not going. Answer: D. I don't want to go, and I'm not going. Rationale: an assertive response expresses feelings clearly while respecting personal boundaries. 159. A nurse is caring for a patient diagnosed with obsessive-compulsive disorder, OCD. Which behavior requires intervention? A. The patient performs rituals in private. B. The patient expresses a desire to reduce compulsive behaviors. C. The patient spends significant time performing rituals. D. The patient follows a structured routine to complete daily activities. Answer: C. The patient spends significant time performing rituals. Rationale: excessive time spent on rituals interferes with daily functioning and requires intervention. 160. A nurse is caring for a patient with a personality disorder who is frequently manipulative and seeks attention. Which action should the nurse take? A. Set clear, consistent boundaries with the patient. B. Ignore the patient's behavior to avoid confrontation. C. Encourage the patient to express their needs in detail. D. Provide frequent attention to avoid escalation. Answer: A. Set clear, consistent boundaries with the patient. Rationale: establishing boundaries helps manage manipulative behavior and promotes therapeutic interaction. 161. A patient with bipolar disorder is experiencing a depressive episode. Which of the following interventions is most appropriate? A. Encourage participation in stimulating activities. B. Promote isolation to avoid overstimulation. C. Assist the patient in setting small, achievable goals. D. Administer high doses of antidepressants. Answer: C. Assist the patient in setting small, achievable goals. Rationale: during depressive episodes, patients may feel overwhelmed. Small goals help provide structure and a sense of accomplishment. 162. A nurse is caring for a patient who is diagnosed with anorexia nervosa. Which of the following is a priority nursing intervention? A. Encourage the patient to eat in a group setting. B. Provide structured meal times and monitor food intake. C. Offer the patient high-calorie snacks between meals. D. Allow the patient to decide when to eat and what to eat. Answer. B. Provide structured meal times and monitor food intake. Rationale. Structure and monitoring are key to ensuring nutritional intake for patients with anorexia nervosa. 163. A patient diagnosed with generalized anxiety disorder, GAD, is prescribed buspirone. What is an important consideration when educating the patient about this medication? A. It can be addictive and should only be used short-term. B. It should be taken with food to reduce gastrointestinal discomfort. C. It is best taken at bedtime to reduce daytime sedation. D. It works immediately and does not require a tapering dose. Answer. B. It should be taken with food to reduce gastrointestinal discomfort. Rationale. Buspirone should be taken with food to prevent stomach upset. 164. A nurse is working with a patient diagnosed with paranoid schizophrenia. The patient is suspicious of the nurse's motives. What is the best approach for the nurse? A. Reassure the patient that there is no need for concern. B. Avoid asking direct questions about the patient's suspicions. C. Maintain a calm, non-threatening demeanor and be consistent. D. Force the patient to confront their paranoia. Answer. C. Maintain a calm, non-threatening demeanor and be consistent. Rationale. Consistency and a calm approach help to reduce suspicion and build trust with patients experiencing paranoia. 165. A patient with schizophrenia is hearing voices that tell them to harm themselves. What should be the nurse's priority action? A. Ask the patient to describe the voices in detail. B. Assess the patient for suicidal thoughts or plans. C. Encourage the patient to ignore the voices. D. Administer antipsychotic medication immediately. Answer. B. Assess the patient for suicidal thoughts or plans. Rationale. Assessing for suicidal ideation is crucial to ensure patient safety. 166. A nurse is teaching a patient about the potential side effects of antipsychotic medications. Which side effect requires immediate medical attention? A. Weight gain. B. Blurred vision. C. Tremors. D. Muscle stiffness and high fever. Answer. D. Muscle stiffness and high fever. Rationale. Muscle stiffness and high fever may indicate neuroleptic malignant syndrome, a life-threatening condition requiring immediate intervention. 167. A nurse is caring for a patient with obsessive-compulsive disorder, OCD. The patient is refusing to participate in therapy. What is the nurse's best response? A. You must participate to improve your condition. B. It's important for you to take control of your therapy. C. Let's talk about the benefits of participating in therapy. D. I understand you don't want to, but therapy is necessary for your recovery. Answer. C. Let's talk about the benefits of participating in therapy. Rationale. A collaborative approach encourages patient involvement without pushing them into therapy, which may increase resistance. 168. A patient diagnosed with major depressive disorder expresses feelings of hopelessness. What is the most appropriate nursing intervention? A. Encourage the patient to focus on positive thoughts. B. Offer supportive listening and acknowledge their feelings. C. Provide information about the benefits of medication. D. Tell the patient that things will improve soon. Answer. B. Offer supportive listening and acknowledge their feelings. Rationale. Offering emotional support and validating the patient's feelings is essential in building trust and reducing feelings of isolation. 169. A nurse is providing care for a patient experiencing alcohol withdrawal. Which of the following is the most important for the nurse to monitor? A. Blood pressure. B. Respiratory rate. C. Blood sugar levels. D. Fluid intake. Answer. A. Blood pressure. Rationale. Increased blood pressure is a key sign of alcohol withdrawal, and monitoring it closely helps detect complications, such as delirium tremens. 170. A nurse is planning care for a patient diagnosed with antisocial personality disorder. Which approach is most effective? A. Establish clear, consistent boundaries and expectations. B. Focus on developing a close relationship with the patient. C. Use confrontation to address manipulative behaviors. D. Encourage the patient to explore past trauma. Answer. A. Establish clear, consistent boundaries and expectations. Rationale: patients with antisocial personality disorder benefit from clear and consistent boundaries to help manage manipulative behaviors. 171. A patient with post-traumatic stress disorder, PTSD, is experiencing nightmares. What intervention should the nurse include in the care plan? A. Teach the patient relaxation techniques before bedtime. B. Encourage the patient to confront the trauma during sleep. C. Suggest the patient avoid sleep aids to prevent dependency. D. Allow the patient to sleep in a secluded area to reduce triggers. Answer: A. Teach the patient relaxation techniques before bedtime. Rationale: relaxation techniques can help manage anxiety and reduce the frequency of nightmares in PTSD. 172. A nurse is working with a patient diagnosed with dissociative identity disorder, DID. Which of the following is the nurse's most appropriate intervention? A. Encourage the patient to confront each alternate personality. B. Support the patient in gaining control over the different personalities. C. Allow the patient to separate from their other identities. D. Challenge the alternate personalities directly. Answer: B. Support the patient in gaining control over the different personalities. Rationale: supporting the patient in understanding and managing alternate personalities fosters integration and healing. 173. A patient with bulimia nervosa is admitted to the hospital. Which of the following is the nurse's priority concern? A. Preventing electrolyte imbalances. B. Encouraging regular exercise. C. Providing high-calorie meals. D. Monitoring for gastrointestinal complications. Answer: A. Preventing electrolyte imbalances. Rationale: bulimia nervosa is associated with electrolyte disturbances, particularly from purging behaviors, which can be life-threatening. 174. A nurse is caring for a patient with depression who is taking an SSRI. The patient reports feeling better but is still having trouble sleeping. Which action should the nurse take? A. Encourage the patient to stay active during the day. B. Suggest the patient take a sleep aid with the SSRI. C. Advise the patient to avoid caffeine during the day. D. Recommend adjusting the SSRI dose for better sleep. Answer: A. Encourage the patient to stay active during the day. Rationale: physical activity during the day can help improve sleep without compromising the SSRI treatment. 175. A nurse is assessing a patient diagnosed with schizophrenia who reports hearing voices telling them to harm others. What is the nurse's priority action? A. Ask the patient about their command hallucinations and assess for intent. B. Reassure the patient that the voices are not real. C. Advise the patient to ignore the voices. D. Suggest the patient focus on positive thoughts. Answer: A. Ask the patient about their command hallucinations and assess for intent. Rationale: the priority is to assess the patient's intent to harm others, as command hallucinations are a significant safety risk. 176. A patient with anxiety disorder is prescribed a benzodiazepine. What is the nurse's priority teaching point? A. The medication can be stopped abruptly once the patient feels better. B. It is important to take the medication exactly as prescribed to prevent dependency. C. The medication should only be taken when the patient feels anxious. D. The medication can be taken in large doses for quicker relief. Answer: B. It is important to take the medication exactly as prescribed to prevent dependency. Rationale: benzodiazepines are habit-forming, so it's important to follow prescribed doses to avoid dependence. 177. A nurse is caring for a patient with schizophrenia who is experiencing auditory hallucinations. What is the best initial response by the nurse? A. I hear the voices too, and I think they are trying to communicate with you. B. Ignore the voices and focus on this conversation. C. I understand that you are hearing voices. I will help you stay safe. D. That is not real. Stop listening to the voices. Answer: C. I understand that you are hearing voices. I will help you stay safe. Rationale: acknowledging the hallucinations and providing reassurance helps the patient feel supported while ensuring safety. 178. A nurse is caring for a patient with a history of chronic depression who is starting treatment with a selective serotonin reuptake inhibitor, SSRI. Which of the following should the nurse monitor for during the initial phase of treatment? A. Increased energy and motivation. B. Symptoms of serotonin syndrome. C. Weight gain and fluid retention. D. Decreased blood pressure. Answer. B. Symptoms of serotonin syndrome. Rationale. Serotonin syndrome is a potentially life-threatening condition that can occur when starting SSRIs, and it requires immediate medical attention. 179. A patient with obsessive-compulsive disorder, OCD, is becoming increasingly distressed due to an inability to complete their rituals. What is the nurse's best response? A. Try to focus on something else and don't worry about the rituals. B. Let's discuss the importance of reducing your rituals. C. It's important to do the rituals to feel better. D. You should try to stop the rituals immediately to make progress. Answer. B. Let's discuss the importance of reducing your rituals. Rationale. Discussing the importance of reducing rituals helps the patient understand the need for treatment and progress. 180. A nurse is assessing a patient for risk factors associated with suicide. Which of the following is a significant risk factor for suicide? A. Recent improvement in mood. B. Family history of depression. C. Male gender. D. Chronic illness. Answer. A. Recent improvement in mood. Rationale. A sudden improvement in mood may indicate the patient has made a decision to end their life, and this should be closely monitored. 181. A nurse is working with a patient diagnosed with borderline personality disorder. Which of the following is an appropriate nursing intervention? A. Set clear, consistent boundaries and limits. B. Encourage the patient to express anger toward staff. C. Establish a close, personal relationship with the patient. D. Avoid setting limits to prevent the patient from feeling rejected. Answer. A. Set clear, consistent boundaries and limits. Rationale. Patients with borderline personality disorder benefit from clear, consistent boundaries to help manage impulsivity and emotional instability. 182. A nurse is caring for a patient with a history of alcoholism who is experiencing alcohol withdrawal. What is the nurse's priority action? A. Provide a calm, quiet environment. B. Administer benzodiazepines as prescribed. C. Offer the patient fluids to maintain hydration. D. Encourage the patient to participate in group therapy. Answer. B. Administer benzodiazepines as prescribed. Rationale. Benzodiazepines are used to manage withdrawal symptoms and prevent seizures and delirium tremens. 183. A patient is experiencing a panic attack. What should the nurse do first? A. Encourage the patient to breathe slowly and deeply. B. Offer the patient a sedative to calm down. C. Ask the patient to lie down and rest. D. Provide reassurance that the feeling will pass. Answer. A. Encourage the patient to breathe slowly and deeply. Rationale. Breathing slowly and deeply helps to activate the parasympathetic nervous system and reduces panic symptoms. 184. A nurse is working with a patient diagnosed with post-traumatic stress disorder, PTSD. Which of the following interventions is most appropriate? A. Encourage the patient to avoid discussing the trauma. B. Help the patient identify and express feelings about the trauma. C. Suggest the patient suppress memories of the trauma. D. Focus solely on the patient's present behavior. Answer. B. Help the patient identify and express feelings about the trauma. Rationale. Helping the patient process traumatic memories in a safe environment is crucial for recovery from PTSD. 185. A nurse is caring for a patient with an anxiety disorder. The patient expresses excessive worry about future events. What is the best approach for the nurse? A. Reassure the patient that there is no need to worry. B. Encourage the patient to focus on positive thoughts. C. Help the patient develop coping strategies for anxiety. D. Tell the patient to avoid thinking about the future. Answer. C. Help the patient develop coping strategies for anxiety. Rationale. Teaching coping strategies such as relaxation techniques or problem-solving helps the patient manage anxiety. 186. A nurse is planning care for a patient with obsessive-compulsive disorder, OCD. What is the most important goal for this patient? A. To decrease the frequency and intensity of compulsions. B. To eliminate all rituals and compulsions. C. To promote social interactions and engagement. D. To encourage the patient to confront their fears directly. Answer. A. To decrease the frequency and intensity of compulsions. Rationale. The goal is to reduce the distress caused by compulsions, not to eliminate them entirely at first. 187. A nurse is caring for a patient who has been diagnosed with major depressive disorder. The patient is expressing feelings of worthlessness. Which of the following interventions should the nurse implement? A. Provide positive reinforcement and set small, achievable goals. B. Encourage the patient to isolate themselves to prevent further distress. C. Suggest the patient stop thinking about their problems. D. Tell the patient that their feelings are not valid. Answer. A. Provide positive reinforcement and set small, achievable goals. Rationale. Positive reinforcement and achievable goals help patients regain confidence and build momentum in their recovery. 188. A nurse is caring for a patient with bipolar disorder who is currently in a manic episode. Which of the following is the priority nursing intervention? A. Encourage the patient to express their feelings freely. B. Set limits on inappropriate behaviors and manage stimuli. C. Allow the patient to make their own decisions. D. Provide a quiet, dimly lit environment. Answer. B. Set limits on inappropriate behaviors and manage stimuli. Rationale. During a manic episode, patients may exhibit impulsive and disruptive behaviors. Setting limits and controlling stimuli helps prevent further agitation. 189. A nurse is caring for a patient who has been prescribed lithium for bipolar disorder. Which of the following should the nurse monitor for? A. Hypothyroidism. B. Hypertension. C. Electrolyte imbalances. D. Weight loss. Answer. C. Electrolyte imbalances. Rationale. Lithium can cause electrolyte imbalances, particularly low sodium levels, which can lead to lithium toxicity. 190. A nurse is assessing a patient diagnosed with schizophrenia. The patient is experiencing delusions of grandeur. What is the nurse's best response? A. You're not a famous person. That is just your imagination. B. Tell me more about your thoughts on being famous. C. You need to accept that you're not important. D. Everyone has important qualities, but these ideas might not be accurate. Answer. B. Tell me more about your thoughts on being famous. Rationale. Validating the patient's feelings and encouraging discussion helps reduce anxiety and provides insight into the delusions. 191. A nurse is caring for a patient with alcohol use disorder who is undergoing detoxification. Which of the following is the most important intervention? A. Monitor for signs of withdrawal and administer medications as prescribed. B. Encourage the patient to participate in group therapy sessions. C. Offer the patient a high-calorie diet to support nutrition. D. Assist the patient in expressing their feelings about alcohol use. Answer. A. Monitor for signs of withdrawal and administer medications as prescribed. Rationale. Monitoring for withdrawal symptoms and administering medications as prescribed ensures safety during detoxification. 192. A nurse is teaching a patient with anxiety disorder about the use of relaxation techniques. Which of the following techniques should the nurse recommend? A. Progressive muscle relaxation. B. Deep breathing exercises. C. Visualization techniques. D. All of the above. Answer. D. All of the above. Rationale. All of these relaxation techniques are effective in reducing anxiety by helping the patient achieve physical and mental relaxation. 193. A patient diagnosed with anorexia nervosa is refusing to eat. What is the nurse's priority intervention? A. Provide high-calorie, nutrient-dense meals. B. Encourage the patient to eat in a group setting. C. Offer the patient small, frequent meals. D. Set strict meal times and monitor food intake. Answer. D. Set strict meal times and monitor food intake. Rationale. Structured meal times and monitoring food intake are essential in addressing malnutrition and promoting eating behaviors. 194. A nurse is caring for a patient with a history of suicide attempts. The patient is expressing hopelessness and despair. What is the most appropriate response by the nurse? A. You need to stop feeling sorry for yourself. B. I am concerned about your safety. Let's talk about how you're feeling. C. Things will get better soon. Just give it time. D. You've been through tough times, but you'll be fine. Answer. B. I am concerned about your safety. Let's talk about how you're feeling. Rationale. Expressing concern for the patient's safety and providing a supportive, non-judgmental environment can help reduce the risk of suicide. 195. A nurse is caring for a patient diagnosed with obsessive-compulsive disorder, OCD. The patient expresses frustration with their inability to stop their compulsive behaviors. Which of the following is the nurse's most appropriate response? A. Try to stop your rituals and you'll feel better. B. I understand your frustration. Let's work together to reduce your compulsions. C. You just need to focus on something else and ignore the rituals. D. It's not that important, just try to relax. Answer. B. I understand your frustration. Let's work together to reduce your compulsions. Rationale. Acknowledging the patient's feelings and offering collaborative strategies helps foster trust and encourages progress in treatment. 196. A nurse is caring for a patient who has been diagnosed with borderline personality disorder and is exhibiting self-harm behaviors. What is the nurse's priority intervention? A. Assess the patient's safety and the severity of self-harm. B. Encourage the patient to talk about their feelings. C. Set limits on self-destructive behavior. D. Refer the patient to a psychiatrist for further evaluation. Answer. A. Assess the patient's safety and the severity of self-harm. Rationale. The priority is ensuring the patient's safety by assessing the level of risk for self-harm and implementing appropriate interventions. 197. A nurse is caring for a patient with schizophrenia who is exhibiting positive symptoms, such as hallucinations. Which of the following interventions is most appropriate? A. Encourage the patient to engage in social activities. B. Reality orientation and distraction from the hallucinations. C. Provide a quiet, isolated room for the patient. D. Tell the patient that the hallucinations are not real. Answer. B. Reality orientation and distraction from the hallucinations. Rationale. Using reality orientation and redirecting the patient's attention helps reduce the impact of hallucinations. 198. A nurse is caring for a patient who has been diagnosed with a major depressive disorder. The patient is beginning antidepressant therapy. What should the nurse emphasize during teaching? A. The medication will take immediate effect. B. The medication may take several weeks to show full effect. C. The medication should be stopped as soon as symptoms improve. D. The patient should not experience any side effects. Answer. B. The medication may take several weeks to show full effect. Rationale. Antidepressants typically take several weeks to become fully effective, and patients should be informed of this expectation. 199. A nurse is planning care for a patient with dissociative identity disorder, DID. Which of the following interventions is most appropriate? A. Help the patient integrate the different personalities. B. Allow the patient to separate from their identities. C. Encourage the patient to confront traumatic experiences. D. Set limits on switching between personalities. Answer. A. Help the patient integrate the different personalities. Rationale. Integrating the different personalities is an essential goal in treating dissociative identity disorder. 200. A nurse is caring for a patient with a history of bulimia nervosa who is receiving treatment. Which of the following is a priority nursing intervention? A. Encourage the patient to eat a balanced diet. B. Monitor the patient's electrolytes and hydration status. C. Encourage the patient to exercise regularly. D. Suggest the patient engage in group therapy. Answer. B. Monitor the patient's electrolytes and hydration status. Rationale. Bulimia nervosa often leads to electrolyte imbalances due to purging behaviors, and monitoring for these imbalances is a priority for patient safety.